You look into the toilet, you see foam on your urine, your heart starts racing. Your mind jumps to kidney failure, you think about dialysis. You think your life will never be normal again. This reaction is very common. I see it daily in clinic. Patients come anxious, patients come scared, sometimes patients cannot sleep. Today this video is very important for you, because foamy urine is one of the most misunderstood signs. It creates fear, it creates panic, and in many cases, it is completely harmless. By the end of this video, you will understand why foamy urine happens. You will know which causes are harmless. You will know which causes need attention. And most importantly, you will feel calm and confident. Foamy urine simply means bubbles on the urine surface. These bubbles may look thick, they may look thin, they may disappear quickly, or they may stay longer. Foamy urine is very common. Almost everyone notices it at some point, especially early morning, especially when urine flow is strong. Many healthy people have foamy urine. They have normal kidneys, they have normal tests, yet they are scared. The problem is not foamy urine, the problem is misinformation. People search online. They see scary words, they see worst case scenarios, they assume the worst. This creates fear, not disease. Foamy urine becomes important only when it is persistent and associated with abnormal tests. Now let us understand the causes. One very common cause is fast urine flow when the bladder is full. Urine comes out with pressure, air mixes with urine, foam forms. This is very common in morning urine. It is more noticeable in men. It is completely harmless. Another very common cause is dehydration. When you drink less water, urine becomes concentrated. Concentrated urine traps air easily. This creates bubbles. Many people do not drink enough water, especially in busy routines, especially in hot weather. Diet also plays a role. High protein meals, large meat portions, protein powders, protein shakes. Protein behaves like soap. Even normal temporary increase can increase foam. This does not mean kidney disease. It means dietary effect. Soap or cleaning agents in toilet are another overlooked cause. Even small residue can create foam. Many patients panic when the toilet is. The cause, stress, also matters. Stress hormones affect urine flow. Stress affects hydration. This can increase foam. Now let us talk about medical causes. One important cause is protein loss in urine. This is called proteinuria. Protein normally stays in blood. Kidneys act like a filter. They prevent protein loss. When this filter becomes leaky, protein leaks into urine. Protein creates persistent foam. Conditions that cause this include diabetes, high blood pressure, certain kidney diseases. But remember, not every foamy urine has protein, and not every protein loss leads to kidney failure. Some medicines may increase protein leakage. Frequent painkiller use, unregulated herbal medicines, bodybuilding supplements. People at higher risk include people with diabetes, people with high blood pressure, people with swelling in legs or face, people with family history of kidney disease. Now let us talk about impact. What happens if foamy urine is ignored? If foamy urine is due to dehydration, nothing bad happens. Hydration corrects it. If foamy urine is due to diet, diet correction improves it. If foamy urine is due to protein loss, ignoring it for a long time can slowly damage kidneys. This damage is slow. It takes years, not days, not weeks. Early detection protects kidneys. That is why evaluation matters. Now let us understand how doctors evaluate foamy urine. Doctors first listen carefully. They ask about duration. They ask about frequency. They ask about swelling. They ask about urine color. Then simple urine tests are done. A urine routine test checks protein, checks sugar, checks infection. If protein is present, it is measured properly. Sometimes a spot urine protein test. Sometimes a 24-hour urine collection. This 24-hour urine test measures exact protein loss. It helps understand why protein appears and how to prevent progression. Blood tests are also done to check kidney function, sugar control, blood pressure-related damage for junior doctors always. Correlate symptoms with tests, never diagnosed by appearance alone. Foam is subjective. Protein measurement is objective. Now let us focus on prevention and long-term control. Hydration is the most important step. Drink water regularly. Spread intake throughout the day. Diet moderation is essential. Avoid excessive protein. Avoid unnecessary supplements. Normal home diet is enough. Kidneys do not need extra protein. Control diabetes tightly. Control blood pressure consistently. Avoid unnecessary painkillers. Avoid self-medication if protein is present. Doctors may prescribe protective medicines. These medicines reduce protein leakage. They slow kidney damage. Regular follow-up is crucial. Monitoring urine protein helps adjust treatment early. Now let us address myths, because myths cause the most fear. Foamy urine always means kidney failure. This is false. Foamy urine means dialysis is inevitable. This is false. Once foam appears, kidneys are permanently damaged. This is false. Every bubble is protein. This is false. The truth is simple. Persistent protein proven by tests matters, not occasional foam. Now some pearls for junior doctors. Always reassure patients first. Fear blocks understanding. Repeat urine tests. If needed, transient protein exists. Look for reversible causes, dehydration, infection, exercise. Educate patients about hydration. It prevents unnecessary anxiety. Never ignore persistent protein. Early intervention saves kidneys. Avoid over-investigation, but never dismiss patient concern. Now let us conclude calmly. Foamy urine is common. Foamy urine is often harmless. Foamy urine needs proper evaluation. Not panic. Simple tests give clear answers. Early advice prevents complications. Most patients do very well. If this video helped you, please like this video. It supports this educational effort. Subscribe for weekly kidney, bladder, and prostate education. Simple explanations, trusted medical guidance. Comment your questions below or suggest future topics. Share this video with someone who gets scared seeing foamy urine. Thank you for watching.